Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. The topic for today is association between clinical vision measures and visual perception and soccer referees' on-field performance. I'd like to thank our host, Dr. April Jasper, our topical expert, Dr. Nick Fogt, and our topical editor, Dr. Maureen Plaumann. Dr. Jasper, take it away.
Hi, everyone. I'm April Jasper, and I'm speaking today with Nick Fogt about the Baptista et al. July 2021 OVS paper, and here's the title: Association Between Clinical Vision Measures and Visual Perception and Soccer Referees, On-Field Performance. Welcome, Nick. Can you give us a brief introduction to the paper?
Sure. Thanks for having me. The idea behind this paper was that one of the key things that sports vision practitioners must do is to determine which visual skills are relevant to that particular sport. So which tests and which training methods matter in that sport. We are sort of early on in this process across all sports of figuring this out. So the main contribution of this study, which looked at soccer referees and their visual skills, was to help in determining some of the sort of baseline skills that may relate to performance on the field for these referees.
So let's walk through, as we do every time, what is the purpose of this study?
The purpose of this study was to determine if what were termed in the study generic tests, so mostly typical tests that would be performed in a comprehensive eye exam, typical vision tests and tests of visual perception, could these tests be used to predict on-field performance in soccer referees at a very high-level soccer?
So who were the participants and which tests, you referenced it a little bit, but which tests were performed?
So these were referees and assistant referees at the highest level in Portugal. And these referees were then ranked according to performance, and this ranking was available publicly. Interestingly, only 20% of these officials wore correction or had a history of refractive surgery. And that may point to the idea that referees are a self-selective group. A number of emmetropes perhaps gravitate to refereeing.
So who were the participants? Well, and really, what were you talked about the referees, so what were the findings?
The tests that were performed, I'm sorry, you asked that question earlier. The tests that were performed were distance visual acuity, stereo acuity, and then a number of visual perceptual skills like visual discrimination, visual memory, and visual form constancy.
Right.
It turns out that the two things that mainly related to correlated to the ranked order of success that these referees had were stereopsis and the visual memory test from the TVPS battery of tests. So that the authors then went on to relate why those particular tests perhaps were related to performance on the field.
And then what would you say were the key messages from this paper that optometrists can use in practice? And then obviously anything else you want to add in too that I've left out, Nick, definitely do so.
Yeah, so I think the most important things are that initially, or the first thing that stands out is the results of this study established some tests, stereo acuity and visual memory, related to on-field performance that doctors will want to consider running on coaches and referees during the comprehensive exam to see if they're deficient. And although stereo acuity, as usually assessed by near test, was associated with referee performance, it's not really clear why this link exists. Most of the things that a referee would be required to do are at distance, for example, or would be considered dynamic stereopsis. So I think that points to the idea that we probably at this point should not dismiss tests that don't immediately appear to be related to what is done on the field for athletes and referees. That is to say, perhaps some of these tests like stereopsis are what the authors refer to as proxies for performance, even though it may be difficult to imagine how that test applies on the field. The other thing I would say is that visual memory, which is whereby you see something, you have to keep it in your mind and then process it. For example, an offsides call in refereeing in soccer seems to make sense with what these soccer referees need to do on the field. And then finally, doctors may consider these findings when working with patients who coach or referee sporting events, as I mentioned, and adding in, as I mentioned, stereo testing and visual memory to the comprehensive exam. That ultimately forms the basis for testing and perhaps training referees to raise their performance.
Wow, that's incredible. I think many of us see those patients in our practice, and without this information, we don't really know how much that can make an impact on their ability to do better in their position. So this is great information. Thank you so much, Nick.
Mm-hmm.
So thank you all for listening, and we will be back with more with Dr. Fogt on the next podcast.
And a special thanks to CooperVision for their educational grant to make it all happen.